Hey everyone, Dr. Hanisha here. Thank you so much for joining me on my podcast, Mahan Health with Dr. Hanisha. Mahan literally translates to great in Sanskrit, and it only makes sense to have the absolute best when it comes to your health. My goal is by listening or watching this podcast, you're getting just a little bit closer to achieving Mahan or great health yourself. This podcast is all for you, so please make sure to comment what you'd like to learn more about so I can get a guest on the show who's an expert in that field, or I might even talk about it myself. I do see patients and clients all over the world virtually, so make sure to book your free 15-minute phone call today to see how you can start achieving Mahan or great health yourself. Also, I am super excited today because now I am officially working with the Berkey Water Filter Company. And so this filter is amazing. I absolutely love my Berkey. It filters over 200 contaminants, including a number of heavy metal toxins that are often found in our water that can affect our gut health, hormones, brain, mental health, and so much more. It also has a fluoride filter, which you do have to get separately, but it's definitely worth it. If you use my code Dr. Hanisha, that's Dr. Hanisha, you can get 5% off of your order, which may not seem like much, but it definitely helps with such a great water filter to drink and bathe in. We should all be drinking at least 80 ounces of water daily, and we should normally shower every day, so it is crucial to make sure that we have the highest quality water. I will have information on my code and everything in the show notes below, so make sure to check that out. All right, let's talk about the episode for today. Today's episode, we're talking about integrative oncology with Dr. Gurdev Parmar. He is one of the greats when it comes to this topic and has actually written the textbook on naturopathic oncology, so he's kind of a big deal. Here's a little bit of information about Dr. Parmar before we get into the interview. Dr. Gurdev Parmar is the co-founder and medical director of the largest integrated healthcare facility in Canada, the Integrated Health Clinic. He is licensed in both British Columbia, Canada, and Washington State in the U.S. IHC was chosen as one of 7 original clinics to participate in the Canadian and U.S. Integrative Oncology Study, an ongoing multi-clinic prospective trial. Dr. Parmar has also completed an 8-year retrospective study on his treatment approach, which has been presented internationally and has recently been published by Cambridge scholars. Dr. Parmar is also a residency director and primary teaching supervisor of a naturopathic oncology residency at IHC, which is a CNME-approved post-doctoral training facility for Bastyr University. Dr. Parmar established locoregional hyperthermia treatment in Canada in 2009 and in 2018. He was nominated president of the International Clinical Hyperthermia Society. He has served on numerous boards over the years, including the OncANP Delphi Panel, with the resulting document published in Integrative Cancer Therapies. Dr. Parmar writes and lectures internationally on a wide variety of topics, including clinical hyperthermia, the tumor microenvironment, and integrative cancer care. He has served on the editorial board of several medical journals and is the lead author and editor-in-chief of the Textbook of Naturopathic Oncology, a desktop guide to integrative oncology, as well as the Pearls Clinical ebook series. So as you can see, he's kind of a big deal. So I'm excited for you all to listen to this episode. He's just a wealth of knowledge. So make sure to rate and review the podcast and let us know what you thought of this episode, and then reach out to Dr. Parmar or myself after the show. All right, I'm not going to hold you up any longer. Go ahead and enjoy. Hello, Dr. Parmar. How are you doing today?
Good, Dr. Nisha. How are you?
I am doing well. It's so great to connect with you. It's been so nice to meet you like a few years ago and then reconnect with you at the OncANP conference and everything. And I'm so glad that you're on my show today.
Well, thank you so much for having me.
Of course. All right, so let's get directly into the interview.
Sure.
This first question I asked all of my guests because I think our journeys are super powerful. And so tell us a little bit about your journey and how you got involved in naturopathic medicine.
Okay, so I'm one of those people that knew at a very young age that medicine is something that I was going to pursue. I, of course, had, little periods of time where I thought I'd do other things, like become a marine biologist, for example, at a certain point in my undergrad, or an evolutionary biologist or something like this. But I always felt that medicine was my calling in life. I grew up in a small town in northern British Columbia where there were no naturopathic doctors. The only, let's say, complementary and alternative medicine that was available was chiropractic in my little town. So I didn't even know what naturopathic medicine was until the third year of my undergrad. My undergraduate degree was in biological sciences, really focused on evolutionary biology. And so I was very interested in, the natural world and how humans fit into this natural world, and that, we have a biological system that has evolved over millennia and in relation to this planet of ours. And so I was very interested in anthroposophical medicine early on, botanical medicine, and growing up in an Indian household, I was exposed throughout my life to Ayurveda, and my mom and dad used what I now know are Ayurvedic remedies through my childhood. And, putting warm oil in my ear was a normal thing, or, something with turmeric here or there if I had an ache or a pain. And I just thought that was normal, or khichdi if I had, digestive problems. So now I know that these things are just good old Ayurvedic medicine. But really what brought me to naturopathic medicine was in my last year of my undergraduate degree, I took a course called Darwinian Medicine. And a phenomenal book called Why We Get Sick, written by two evolutionary biologists, who explained from an evolutionary perspective why people have what they have. So, for example, if you roll your ankle, why does it inflame? It's to prevent further movement, so you're not re-injuring it, so it has an opportunity to heal. And getting further and further along the track of going into medicine, I had my own belief systems of how a human body had evolved, and what the best ways to approach it might be from a health perspective. And so that course really cracked the egg, so to speak, opened my eyes to a world of medical theory and approach to treatment that I had never been exposed to through my life. And it was just at around the same time that I was introduced to what naturopathic medicine was. And the concept of being trained as a physician, a doctor, a naturopathic physician, where you're trained in conventional diagnostics, you learn how to do lab testing and ordering imaging and reading imaging and diagnostics, the way that we have all come to do it these days in science, being trained in pharmacology and conventional medicine, but also being exposed to all of the traditional medicine of the world and bringing this together. I couldn't believe my eyes when I saw it for the first time. I thought it was exactly what I had been searching for through my life, and it turns out I was right.
Oh, that's awesome. Oh, I'm so excited to check out this book because I am so fascinated by evolutionary biology as well. And so, yeah, I haven't heard of that book, but I definitely am going to check that out because that sounds awesome.
It's excellent. Yeah.
Yeah, for
Oh my
sure.
goodness, I'm so sorry. My house is lighting up.
Yeah, very popular. All right, so now let's talk a little bit about your textbook and the process it took to create it. I know this was like a huge thing. So tell us a little bit about that, and I'm just so excited to learn.
So the textbook of naturopathic oncology is something that I've wanted for a long time. You're now in this field, and you know that to stay on top of the incredible amount of information that we need to as naturopathic oncology practitioners and naturopathic oncologists, it's extraordinary, and it's growing by the year. And I didn't feel that we had a resource that brought it all together, at least for me. I mean, there's some really good books out there that were helpful as far as therapeutics were concerned, but I was really looking for something that helped me think my way through how to approach naturopathic oncology. And so it's something that, as I said, I've been thinking about for a long time, but it wasn't until June of 2014, I, out of necessity, took a 6-month sabbatical from practice. Just needed some time away from my very busy and, sometimes overwhelming oncology practice. And I decided that I was going to take that sabbatical to write this book. And of course, it took much, much, much longer than 6 months. It took 5.5 years and contributions from over 40 of our brightest colleagues from around the world. So it finally was finished last year and released early this year. And I'm happy to say that it's getting in the hands of doctors from around the world. There's been all over Canada and the United States, of course, our profession, and lots of medical doctors, integrative medical doctors, traditional Chinese medicine doctors, some oncologists, radiation and medical oncologists, integrative oncologists. So it's good. As a first edition, I'm very happy with it. And I know it's just the beginning. It's the first edition, and I'm already starting to work on the second.
Wow. Yeah. Yeah. And I forget the number of references you said that are in there. Do you remember at the top of your head?
2,800.
2,800 references. Yeah. So it's clearly a very comprehensive textbook with a lot of different research. Like, it's all research-backed, evidence-based practices in integrative and naturopathic oncology.
Correct.
So, well, speaking of that, I think we kind of jumped a little forward. What is integrative and naturopathic oncology?
Well, that's a good question. I guess there's lots of definitions of what integrative oncology is. Sometimes I see textbooks in conventional medicine that say it's integrative oncology because the integration is between surgical, medical, and radiation oncology, and that's integrative. I think in the context that we're talking about, integrative oncology is the integration of all non-standard therapies or treatment approaches with the standard of care. And so whether that's a naturopathic doctor integrating, or a chiropractor integrating, or a TCM doctor or Ayurvedic doctor integrating, all of those people would say that they practice integrative medicine. And then I would, more define what we do as naturopathic oncology within the larger context of integrative oncology. And so naturopathic oncology is something that really was born out of necessity. Naturopathic physicians, for over a century in North America have long been generalists who treat people from a naturopathic perspective. And, we have our basic premises or basic tenets of what naturopathic medicine is. And, I'm sure you've talked about those things on previous podcasts of your show. So I don't think we need to go there necessarily, but naturopathic oncology has really been born out of necessity, as we've already touched on. The amount of research happening in natural medicine or naturopathic medicine in the world of oncology on an annual basis is dizzying. And for a general practitioner who sees everything, they treat IBS and they treat headaches and hormonal imbalances and everything else that a naturopathic doctor treats, family medicine. And then on top of that, you want to do naturopathic oncology. The amount of research coming out on an annual basis is just so extraordinary that this specialization, the specialty of naturopathic oncology was started in about 2006 by a group of doctors in Canada and the US that had decided that, it was time to form a group that would really bring naturopathic oncology to the next level. And between 2006 and 2020, what we've done as a profession has just been awesome, extraordinary. It's been fun to be a part of it. It's been fun to watch it. We have some very bright minds in our profession. And we have now come up with, a new profession, essentially, over the last 14, 15 years. It's in its early stages, but already it is impacting the lives of millions of people around the world with cancer. And I truly believe that this is going to be a part of most people's journey with cancer as time goes on, because the truth is the truth, and it shall always prevail. And the evidence to support what we do is now gaining momentum, and I don't think that momentum can be stopped. So I see this happening more and more, not less and less.
Yeah, definitely. And I'm so hopeful for that as well. And I completely agree. I feel like we're definitely on that track to where more and more people get to experience naturopathic oncology, or like true integrative oncology, where we all work together with the medical oncologist, the radiation oncologist, and the naturopathic oncologist together. And so, yeah, that's really cool. And so can we talk a little bit about the additional training that, so I definitely have not done this training, but you have, and there are so many other practitioners in the US who have done this additional training for naturopathic oncology. So what does that kind of look like?
So, there have historically been two tracks to becoming a naturopathic oncologist or a naturopathic oncology practitioner. One is for people that are already in active practice, a minimum of 5 years where at least 50% of your practice is oncology, and a certain amount of continuing education, and then, of course, achieving standards, flag posts through that 5 year, and ultimately sitting the FABNO exam. So that's, and I'll explain what that means. And then, of course, there's the other track, which is the residency track. So after your 8 years of becoming an ND, an additional 2-year residency, where available, usually in a hospital setting or in a private practice clinical setting, where a new graduate or an old graduate, for that matter, does a 2-year residency where they must achieve an exceptional amount of didactic learning and practical learning in oncology, including rotations with medical oncology, radiation oncology, surgical oncology, palliative medicine. So that new graduate from the residency has had exposure to all of the other fields of oncology that exist. And then ultimately to sit this FABNO exam, which is very challenging. It's renewed on an annual basis. I sat the first exam in 2007, and so the FABNO exam is the Fellow of the American Board of Naturopathic Oncology. So this is a fellowship, 2-year residency, 5-year in practice tracks. This is, and our association is the Oncology Association of Naturopathic Physicians.
Okay, yeah, thank you for sharing that and explaining that really well, because there is, I think it's important for people to know that there is an extended training that naturopathic oncologists do before being considered naturopathic oncologists. So it's really, really helpful. And then in terms of, like, we did talk about this more integrative practice, how do NDs usually work with oncologists? Like, what would it look like from a patient perspective if they were to come to see you and work with you for their cancer treatment?
It's a great question. So I'm sure this varies from practice to practice, province to province, state to state, with jurisdictions having different licensing, etc. But I think the best thing for me to do is to describe my own experience with how to collaborate. At an initial visit, so I have a patient comes to see me for their initial visit. It's an hour visit. do a full history where I have to request their pathology report, their imaging reports, their laboratory reports, their medical and radiation and surgical oncologists' notes, and that's all reviewed prior to the initial visit. At the initial visit, a history is taken, a full physical examination is taken, and then an initial plan is provided. And that initial plan is not only given to the patient, but also to that patient's general practitioner, primary care, whatever you guys want to call them, and then to their oncology team. And that begins the communication between myself and their other providers. And then, you know, of course, it doesn't always work out the same with everybody. Some doctors are open to collaboration, some are less so. But at the very least, I communicate what I'm doing with the other doctors. So, you know, the patient's best interest is put forward. So everybody's aware of what plan I've given the patient. Everybody has a chance to review what it is, look for drug to drug, drug to nutrient, drug to herb interactions, whatever. And that is one example of how collaborative care might happen for one of my patients.
Yeah, I think that's really cool, and I really appreciate that naturopathic doctors, especially naturopathic oncologists, work with the other providers, because like you said, it's about the patient, right? It's about them getting the quality of care that they deserve, and it has nothing to do with the practitioner, right? Like it's all about them getting better.
Absolutely, it's 100% about the patient, and the collaboration is about the patient.
Exactly.
The communication is about the patient.
Mm-hmm.
And that always, yeah, I agree with you that intention always needs to be first and foremost, right at the front.
Exactly. And so I definitely appreciate that a lot. And I think a lot of our patients appreciate that, right? That's
Absolutely.
so important. Okay, and then my next question was, so you said that you do share your plan with the other providers that the patient is working with. What are some things that, you know, or modalities or things that you would normally use for patients who come in with cancer in general?
So, you know, the low-lying fruit, the most consistently used modalities amongst all of my patients. I know my associates in my practice, everybody that I work with, anybody that I collaborate with outside of my practice, doctors from all over Canada and the US, there's certain things that I think all of us will do. We will all discuss with our patients what a good nutritional or dietary plan looks like for them given their diagnosis. I think all of us are interested in talking about lifestyle interventions, you know, sleep hygiene and exercise and the importance of it, and you know, all of these lifestyle, stress reduction, mindfulness, these things. I think everyone in our profession is doing these things with their patients with cancer.
Definitely. Like the foundations of health, just
The
establishing the
foundations, the
foundation.
fundamentals, the pillars of health. And
Definitely.
that's no different for a person who's healthy,
Right.
or somebody preventing cancer, or somebody going through treatment, or somebody that's already been through treatment. Now they're in survivorship and they're in secondary prevention. These things are well supported in research, and you know, our job is to help those people navigate what's true and what's bunk, because there's a lot of information out there that's not real. And you know, I think a large part of our jobs is actually encouraging our patients to do integrative medicine rather than alternative, because you'll see most of my colleagues say the same thing, and I say this, you know, I spend half of my days explaining to people why making use of standard of care is in their best interest, is the right thing to do, and that we're going to collaborate and integrate, not be alternative. So that's a big part of our jobs. And then, you know, physical modalities like physical medicine, adjusting hard tissues, soft tissues, cold, hot, hydrotherapy, hyperthermia, all these physical modalities. There's innumerable physical modalities. There's nutritional supplementation. There's botanical medicine, whether it's TCM botanicals or Ayurvedic botanicals or North American or European, all of that. And then IV or injection therapies. So, whether it's intravenous, whatever, or injection, whatever. So these sorts of therapies. Most jurisdictions, there's prescription drugs. So just the same as your general practitioner or oncologist, the ability to prescribe pharmaceutical agents when necessary and judiciously. And then, more advanced things like, intravenous vitamin C or mistletoe therapy or locoregional hyperthermia, fever range, whole body hyperthermia, ozone. I mean, there's a whole bunch of advanced therapies that are used in our profession that require advanced training that also are modalities that we could be using.
Definitely. And this is why, because there's so many options, so many different modalities that people can use. This is why it's so important to work with a naturopathic oncologist like yourself, so that you can gear that towards that patient, right? You can individualize it and be like, all right, this is what's going to be best for you at this time with the type of cancer that you have, the stage that you're at, whatever it may be, and really figure that out. Correct.
Absolutely. And, as people undergoing conventional cancer treatment, if they're using chemotherapeutic agents or targeted agents or immunotherapeutic agents, these are serious medications with serious implications. And depending on, the intention, if it's curative intent with those drugs, the naturopathic practitioner must know that they're taking the back seat at that time. There's a curative intent with conventional medicine, and to talk their patient through that. And if it's palliative intent, how to best allow the patient to continue to use that treatment. They don't get dose-limiting toxicities. They have to stop doing the treatment because they can't do it anymore. That's a part of our job. And helping prevent these dose-limiting toxicities, helping manage the potential side effects and risks, and what can we do to make it work better? There's that piece. So I think I have an 8-year study that shows, retrospectively, this is not a controlled study, but retrospectively, longitudinally, we've been able to show that our patients that make use of naturopathic oncology alongside standard of care have a better survival and a better quality of life.
Yeah.
And I'm very interested to see the results of the CUSIOS trial, which was a prospective trial. And our clinic is one of the centers involved in the CUSIOS trial. And I really look forward to the results of that sort of trial, just to, again, further promote the evidence that integration of naturopathic medicine actually leads to better outcomes.
Definitely. And actually, that's a great point that you bring up. So if there was a medical doctor, a medical oncologist who was listening to this podcast right now, would you say that your textbook actually gives a lot of these resources on ways that these modalities that we use in naturopathic oncology can support patients going through cancer treatments?
Absolutely, yes. And there are medical oncologists that were involved in the writing of the textbook, and I'll talk to you a little bit about pearls later on, and I have some medical oncologists that are involved in that as well. So I do think that this would be a valuable resource for anybody working with a patient living with cancer, at least for their own edification, for their own information. Whether they're promoting what's in the textbook or not, it's besides the point. It's at the very least to be able to answer the questions of their patients who, for example, are undergoing a specific type of therapy, and they're asking, is this safe for me to use alongside of this? And for an answer like that alone, this might be useful. Or, I'm having refractory nausea and vomiting, and the pharmaceutical drugs that I've tried everything. I've tried ondansetron, I've tried dexamethasone, I've tried metoclopramide, I've tried everything that you've thrown at me. Nothing's working. And I'm interested in trying something natural in addition to it. What has research? What might help me with this? And I think it would be a useful resource for anybody that's dealing with cancer patients, truthfully.
Yeah, definitely. And that's such a wonderful resource, like you said, for literally anybody who works with patients with cancer. And then also, would you say that because it is more of a textbook, it really wouldn't be for the layperson?
You know, I would say that cancer patients, in my experience, 20 years later, are not really lay people. I think about, you know, I would generally categorize, you know, after 20 years of doing this work, I would categorize cancer patients as a little different than lay people. They very, very quickly become very knowledgeable and educated about what's going on. And I think the thirst for information in an oncology setting is the greatest I've ever seen. I mean, the most recruited patients, the most, you know, on board patients, the most inspirational patients I've ever worked with are cancer patients. And so a lot of patients have bought the textbook, to my surprise. But, you know, one of the things that I'm doing right now, just so you know, is I do feel like the textbook might be a little bit too much for your average patient. You know, there's 24 cancer types in the textbook, but most people living with cancer have one. And so they're not really interested in the information on the other 23. They want to know about what they have.
Right.
And there's, you know, 26 or whatever main symptoms that are reviewed in the textbook. But they might only have a couple of these symptoms. So this is what PEARLS is. So I'm launching PEARLS, P-E-A-R-L-Z. I use the Z because it sounds cool. So it's www.pearls.info. And what this is an ebook library which breaks the textbook up into its individual components. So a person can buy an ebook, for example, just on breast cancer, and then just on, let's say they're interested in alopecia, neuropathy, you know, chemotherapy-induced peripheral neuropathy, and insomnia. Those are the three things that are ruining their life. So they want the information from the textbook on breast cancer and these three symptoms. So now they can buy the ebooks of just what they want. So that's what pearls.info is all about. And it's really the intention of pearls.info is to make what's in the textbook reachable, accessible to the people that need it the most. I really want the patients to have the information in the textbook, and this is, I think, the best way to do it without it being a big textbook. They can just get the information that's most relevant to them in their life.
Yeah, definitely. I love that. Yeah, I saw that video that you have for Pearls, and I was super excited that you're doing this. Like, I mean, it's exactly what you said, like getting that patient the information that they crave and really want to know. And this is really just practicing that principle of naturopathic medicine where doctor is teacher, right?
Right.
And so you're fully embodying that, and I think that's amazing. So thank you so much for doing this for all of us.
Thank you.
Yeah, really appreciate it. Okay, so before we move on to the rapid fire questions, was there anything else that we missed that you would like to talk about, or any other resources that you recommend? Obviously Pearls, but and your textbook, but anything else that you would recommend, or anything else you'd just like to add on?
What do I want people to know? Well, I want people to know about the database, the knowledge of naturopathic oncology database. I don't know the website offhand, which is just a shame, but I do want to plug No. There's also that BCCT. Are you familiar with that?
I'm not.
So this is another resource. Let me just make sure I'm not misspeaking.
Okay.
Um,
And we can put all of this in the show notes below. So I'll put like the actual website for No and everything.
Excellent. Yeah. So it's Beyond Conventional Cancer Therapies.
Okay.
That is an excellent resource, and the No database. Our colleagues, Dr. Jen Green and Dr. Heather Wright, have been at the in the background putting together the No database, which is now just an extraordinarily powerful database of all the research, and it's constantly being updated. So I think that's a great resource, maybe more for practitioners, and then the Beyond Conventional Cancer Therapies may be a better resource for the patient.
Great. Yeah. Okay. Well, thank you so much for sharing. Okay. So let's get into the rapid fire questions. These are the questions that I ask all of my guests. You do not have to answer them rapidly. They're just a little bit quicker than our whole conversation. So my first question for you is, so Mahan Health is all about great health, optimal health. So what does Mahan Health mean to you?
So Mahan Health, I love the term, by the way. Mahan, as you've taught me, means great in Sanskrit. And so we're talking about great health. And what does great health mean to me? Great health to me means much more than the absence of disease. Great health to me means health in, an optimal health, an optimal life requires health on multiple levels, and physical health, and then how do you manage your physical health? Emotional health, how does one look after their emotional health? Psycho-spiritual health, social health, relationships. To me, great health is all of that put together. Great health to me means that you're not just physically well, you're also emotionally well. You've got social connections, you've got relationships, which I think are the most important thing there are. You have psychological health, and for those that go there, spiritual health. Not everybody does. I meet everybody that I work with where they are. So I call it psycho-spiritual health. It's a little bit more approachable for those that aren't spiritual beings. So yeah, I think that's what Mahan Health means to me.
Awesome. Well, thank you so much for sharing. Okay, so the next question I have for you, or next two questions, they could be the same or they could be completely different. It's completely on you. So the first part is, what was the most difficult health change for you to make personally, and what are you still working on?
That's a great question. I'm glad you asked your guests this question. So I think the greatest challenge I've had as far as health is concerned in my personal life has been work-life balance, and finding that and striking that, and then being flexible enough to adjust as life changes, the balance changes. So that ongoing balancing of my work life and my personal life. I have a very rich personal life. I have 4 incredibly active and amazing children. I have, the most incredible partner in my life. And so I try to manage, a wonderful marriage, a wonderful relationship with my life partner, raising 4 children, maintaining friendships, maintaining my relationships with my nuclear family and then extended family, and balancing that with an incredibly busy and fulfilling professional life. We have a massive clinic. We've got a whole bunch of doctors. We have so our clinic life, and then, writing, lecturing, and constantly learning, balancing those things with my personal life. I think that's been my greatest challenge, and it remains my greatest challenge from my health perspective. I feel like I've got my physical health pretty well where I'd like it to be. I play tennis, and that's my love of loves, physically, and I get to do that 3 to 4 days a week. I feel very blessed that I have an amazing team of guys that I get some really great man time with, and we play tennis together, which is a great way to spend time because it's such a great physical outlet and great emotional outlet. But yeah, it's that balance between my personal life and my professional life that I continually am struggling. I don't want to use the word struggling, but it's my constant battle. Yeah.
Yeah, definitely. Well, thank you so much for sharing, because, and this is why I ask all my guests this question, because all of our patients struggle with very similar things, and like someone will resonate with it and be like, oh, okay, like it's okay for me to also be going through this, right?
Absolutely.
And I like how you said, as life changes, we need to work on that work changing as well. And I feel like people forget about that often. So I do appreciate you saying that. Also, I started playing tennis again recently. I played in high school, and then recently I've picked it up again too. So I'm glad you're doing that. So
Awesome. Well, maybe next time at the OncANP, you bring your racket.
We should totally.
Yeah, we have a regular group of people that hit whenever we have an OncANP. So
really? Oh,
yeah, you join our little tennis tribe.
I'm so in.
Right.
Well, I'm excited. Okay, so my last question for you is, if you could have a commercial, like a PSA on health, about anything that we could get out to the whole world, what would it be about and why?
A tough question. Well, I think if I were to have a commercial, I would actually, I think if I were only allowed to have one commercial, I don't think I would have it about anything about me. I actually think that my commercial would be about what we need to do as humanity to clean up our beautiful planet and take care of Mata the way that we should be. I have passion about clean energy. I have passion about cleaning up our oceans. I have passion about regenerative agriculture and rebuilding soil and using that as the way to fix the carbon crisis. Soil is going to fix the carbon crisis, nothing else, and we can recreate this. And I would have a commercial about, you know what, people, it's not too late. We can do this. We've got what we need. We have the knowledge we need. We just need the will. And that's what I would have a commercial about.
Awesome. I really appreciate that. And like, this is something that I talk about consistently in my practice, on my platforms, wherever, is that, when we take care of our environment, the environment is where we get our fuel, right? That's where we get our food and nutrients. And if we take care of our environment will take care of us as well. And so
I believe that with all of my heart.
Yeah. So it really only makes sense to do that.
And I think, it's truly naturopathic medicine at its core is, back to how I got into this. It's evolutionary biology, biological sciences. We are a part of Gaia. We are a part of this planet, and we cannot think of human health in the absence of the world we live in. And I think we need to do a much better job with our planet, and I think that will allow us to, at least at a subconscious level, do a lot better with our health.
Yeah, definitely. I mean, some things even as simple as plastic, right? We learned it was bad for the environment, and then we found research that it was bad for our health. And it's like, it's very consistent. And like you said, we really can't address our own like human personal health without addressing the health of our planet. So, well, thank you so much for sharing that. My last question is, where can people find you? Where are you? Like, are you on social media? Where are you?
So I am being trained a little bit in how I can get more into social media. So I'm a bit of an old dog, Hanisha, and I'm trying. So things like this is my foray. I'm working on it. But where people can find me, integratedhealthclinic.com, www.integratedhealthclinic.com. That's my wife and I started that practice 20 plus years ago, and so a lot of me is there. And then the textbook of naturopathic oncology.com, and now pearls.info. These are some of the places where people can find me, and I think that's probably good for now.
Yeah, that is helpful. All right, well, thank you so much again for joining. I'm so grateful that you decided to come on the show. Thank you.
Yeah, thanks again for the invite. I had fun.
Yeah, me too. All right, take care.
Yeah, you too. Thank you so much.
I hope you all enjoyed that episode. And for those who have a loved one that has recently been diagnosed with cancer, already has been battling cancer, or you just want to know more information, I highly recommend reaching out to a naturopathic oncology provider so that we can integrate that care. It has been found that integrative care has the highest prognosis and increases quality of life for patients dealing with cancer. So I definitely recommend it. Dr. Parmar is a wealth of information, so definitely reach out to him if you have any questions or would like any additional support. I will have all of his information in the show notes below, so like I said, make sure to check him out. But that's all I got for you all today. I'm wishing you all Mahan health, and I will see you next time.